The Edo State Primary Healthcare Development Agency, in collaboration with Carter Center, has launched an important training program for the frontline health workers across the 18 local government areas of Edo State. This initiative aims to enhance the capacity of health workers delivering comprehensive care to patients suffering from conditions such as elephantiasis, hydrocele, with a particular focus on addressing the associated challenges of depression, stigmatization, and anxiety. The training focused on the mental health and well-being of patients. The program seeks to create an inclusive approach that recognizes the emotional and psychological burdens often faced by individuals with this condition.
And we should have what we call whole group, right? Yes. They tell you, you come out and start. The last finger is always medication.
Speaking, the Edo State Primary Healthcare Development Agency's Executive Secretary, Dr. Cruisin Ohaimire, and Director of Carter Center Program for Edo State and Delta States, Dr. Emmanuel Emuka, says that the training is not just to educate the staff on how to manage the mental health of these patients suffering from these tropical diseases, but to create awareness to the general public that the agency can help manage such conditions.
The essence of this training is to train our staff on how to manage neglected tropical disease, which we all know as elephantiasis or filariasis from filaria worm, which can present either from unilateral leg swelling or scrotal swelling. So we want to create this awareness in our society in order to make them to be well aware that we manage this condition in some of our health centers, and to train our staff so that they will be up to date.
The training we are doing here today is part of the holistic activities we are doing for the management of patients that are suffering from the mobility of due to elephantiasis and hydrocele. Mobility of lymphedema and elephantiasis, we also are integrating the management with a mental health program. So that integration, because mental health is the ninth component of the primary health care. So we want to equip the health workers with the capacity to identify among those patients that are suffering from these conditions that we need mental health care and refer them appropriately.
The Director of Disease Control and Immunization, Edo State Primary Healthcare Development Agency, Dr. Oseigbe Efeomo, says that the program is to enlighten the workers on how to manage the mental health of patients suffering from these chronic diseases.
So we're training our healthcare workers on the prevention and then the treatment that they can give to clients in the community who are presenting with symptoms of elephantiasis from lymphatic filariasis, and surgeons have previously been trained in the state who are going to step down to the lower cadre, the lower levels, the healthcare workers at the lower levels, and just now we have nurses and doctors and different other cadre of healthcare workers being trained to be able to handle the management of elephantiasis in patients with lymphatic filariasis, and there's also a psychiatric component because many of these clients we notice are stigmatized and some of them are depressed. So there's a psychiatric component of the training that is going on so that our healthcare workers can know how to manage the mental health of these clients. We think this is a very beautiful initiative by the state government and with support from the Carter Center. Carter Center has been a very strong ally to the state in helping to strengthen our health systems and to ensure that the capacity of our healthcare workers are built.
The State Health TD Coordinator for Neglected Tropical Diseases in Edo State, Mrs. Spoku Happy, says that the training is to teach the healthcare workers on how to provide comprehensive approach on how to manage such patients.
People that are suffering with elephantiasis, hydrocele cases, and those people being faced with stigmatization, discrimination. So we are here to teach them how they can manage themselves, to providing a holistic care approach, integrating it with mental health, how these diseases have been able to affect their mental health. Some of them that have this elephantiasis, that have this hydrocele, come down with depression, anxiety, stigmatization. So we're trying to provide an holistic care approach, teaching these people how to manage these diseases, wash their legs, practice elevation, practice exercises that will help them to manage it. They are not left out with support in this situation.
The Edo State Primary Healthcare Development Agency encourages all stakeholders to participate actively in this endeavor, emphasizing that quality healthcare encompasses not only treatment but also compassion and understanding for those affected by chronic healthcare challenges. In Benin City, Osamu Jame Kennedy reporting for AFMI Reporters TV.